Hello, I'm Professor Patrick McGorry. Welcome to today's webinar. Before we proceed, as Executive Director of Orygen, I would like to acknowledge the traditional custodians of the land on which we work around Australia and pay my respects to elders both past and present.
Hi everyone, my name is Zoe Tay and I'm one of the youth conveners here at Orygen, National Centre of Excellence for Youth Mental Health. And today we've got Ian Johansson from Headspace in Swan Hill, and he'll be talking about community involvement in the development of a youth mental health service. So everybody, welcome Ian Johansson.
Hi everyone, Ian here from Headspace Swan Hill. I'll be taking you through the local story of what we got up to in Swan Hill to help you get an indication of the types of things that might be helpful for your community in establishing some supports and coordinated efforts to improve the mental health of young people. So Swan Hill, we're in the Murray PHN, so that primary health network is in Victoria, and we're situated up in the northwest section of that PHN. And Swan Hill is located between four different Headspace centres. So we've got Mildura to our northwest, Griffith to our northeast, Shepparton, Bendigo and Horsham as well. So that's 5 all up. And we're uniquely located in quite a regional area. And yeah, we're really thankful to have Headspace in our community. But I wanted to talk to you a little bit about the spirit of what we tried to achieve in Swan Hill. And for those of you who know the $20 note, some people call them lobsters, but do you know who's on there? And one of the people that's on the $20 note is John Flynn. And his story from the 19th century was doing work to protect and create a safety net for people in the outback of Australia. And a part of what we're trying to do in Swan Hill is to follow the spirit of John Flynn and to create a safety net for young people in our area so that they can have positive mental health and they can thrive and flourish, and our communities can thrive and flourish as well. So Swan Hill itself is a community of about 10,000 people. But Headspace Swan Hill services a population of about 53,000. So we are talking about a rural and regional network. But one of the beautiful things about rural and regional places is that we can try something that then can be really specifically monitored and evaluated and then can be transferable for other areas. So if you're not in a regional centre or rural centre, some of this might still be helpful because the principles are true. I want to talk to you about the Swan Hill Youth Mental Health Project. So this began back in the end of 2012, and there's some quite unique circumstances around the development of that. And we believe that this work was really essential for coordinating the efforts of our community and the stakeholders involved to focus on young people and to get better outcomes for them. Swan Hill Youth Mental Health Project has got a number of different stages, but initially something that was a real catalyst for our community was producing a report that tried to look at indicators of what was needed in Swan Hill to respond to young people. I'm going to go through this report in a bit more detail, but I want to also focus a little bit on the work that happened beforehand. So some people in our community did some wonderful work to raise the awareness, not of just local people about youth issues in our community, but also the nation. So there are a number of key people that I want to just acknowledge. I won't name them specifically, but to acknowledge that they did a lot of work in raising the awareness of youth issues in our context. Because what often happens in rural centres is that populations can be looked at to base service delivery, and therefore rural communities can miss out. So they have to do a really good job of putting onto the agenda the topic of the youth needs in their area. So 7:30 Report Victoria, at the time an ABC News program, studied and looked at the youth issues that were happening at that time. We had community leaders that led delegations that were fronted by our state and national politicians. And they approached people who are decision makers about youth mental health dollars and youth mental health service decisions that I think planted the seed in them that finally came to fruition at the end of 2014. So this is a number of years' work. So if you're, regardless of the stage that you're at, you might be at a different point. But I encourage you to get your leaders involved and approach the decision makers, because that's a really important part of getting people's awareness up around what your community needs and what young people need. So The Guardian is the local newspaper in Swan Hill, and they had a strong focus on headspace for many years that was built off this effort of community awareness raising and decision makers influencing them to consider the needs of our community. But there was a significant focus on that, and the young people of Swan Hill were still in need. So we made a decision to do some work around improving their outcomes prior to Headspace being announced. So we decided that instead of just waiting for a white horse and a knight on a white horse to come in with a big bucket of money and throw at our young people, we decided, what can we do with the resources that we have now? And I just want to acknowledge the great work that the Murray Primary Health Network did in supporting the coordination of a response. So this screen here will show you that they introduced at the end of 2012 a project that was just 3 days a week. So it cost them about $75,000 per annum. And it was really only going to be a 6-month project to help the community advance their efforts to improving outcomes for young people. This extended beyond 6 months and went for 3.5 years. But the main focus of this project was to work with key stakeholders, to get to know them and to work with them to try and respond to the identified need, to coordinate an evidence-based analysis of what the needs were and the service gaps in Swan Hill, and to identify and develop effective options in addressing the mental health needs of youth in the Swan Hill district. So they were the 3 tasks that we were given, and we pursued it. And at the end of that 6-month period, we produced our report that I referred to earlier. One of the key things that I think are really important, if you're looking to have an influence on decision makers about your community and you're trying to produce something that actually leads to actions that produce better outcomes for young people, is to benchmark what you're achieving. So you need to gather evidence, and what we did at that time was develop evidence from key partners. So these are people who came on board and said, yeah, we will help. We want to respond. We care about young people and we want to do something about it. And I just commend these organisations for how they became involved. So Swan Hill District Health, they provided us data on their emergency department presentations for young people. Bendigo Health Psychiatric Services gave us data on those young people who were referred to their triage service, so those people with psychiatric needs at a tertiary level. Victoria Police provided us some data as well on their apprehensions under the Mental Health Act, and also the National Coroner's Information Service gave us some information. So I want to share with you some of the information that they provided to us. And one thing I didn't mention earlier, I was appointed to that 3-day-a-week position back in 2012. So this graph here will show you the projection and the growth of presentations of young people to Swan Hill District Health Emergency Department for young people aged 12 to 25, starting at the year 2004 through to the time where the project was initiated, 2012. And what you can see there is that over those years there was constant growth in the number of young people who are presenting to the emergency department for a primary diagnosis code that was associated with mental health. So you'll see particularly in 2012, that there was a rapid rise in the number of young girls that were presenting to the emergency department for mental health support. This next slide shows you how many young people were categorised to different diagnostic codes, and we're showing you the top 80% of diagnostic codes here. At the top, mental status alteration is a general term around something not being right with a person's mental state, but it couldn't be well defined. Then you'll see depression is the next greatest diagnostic code. But then the next three, actually, they focus on suicide ideation or suicide risk or suicidality. So young people actually attempting. That third one there, poisoning or overdose, is where a young person may have intentionally taken medications of a quantity with intent to cause themselves harm. So that was concerning for us as a community when we find out that so many young people presenting to the emergency department for these needs when there may be better places for them to seek support. As I mentioned before, there was a rapid rise in the number of young people that were presenting in 2012, and the bulk of them were in the age group of 14 to 16-year-olds. So what we're able to identify was particular needs of a cohort of young people. What we also did at that time was to benchmark ourselves, not just to find out where we were at as a community, but we actually wanted to benchmark ourselves with another community. So what we did was found a community that had a similar cohort of young people. And so we compared ourselves to Echuca. And while Echuca has a population of about 4,000 more, there's only 400 more young people in the age group of 12 to 25 at the time that we actually were doing this work. And what you see here are the Bendigo Health Psychiatric Services referrals. And at that time, there was a lot of division, I think, between service providers. There was not a lot of trust in our environment. And I think there had been a reduced number of referrals in Swan Hill, as explained by this slide, because of the lack of trust between service agencies. And a big part of what we tried to do was actually to bring the service sector together before we sought to do something. In this slide, you'll see the number of mental health apprehensions that were carried out by the police in Swan Hill in blue and Echuca in red. So you'll see that there were far more apprehensions under the Mental Health Act that were carried out in Swan Hill. But I think a part of what we assumed was a part of that greater presentation of young people to the emergency department accompanied by police was because that the community was aware of the issue and the media was focusing on Swan Hill. So Victoria Police took a particular approach to just responding to every concern that there was about mental health. But what we found out was about equal number of young people. In 2011, there was actually the exact same number of young people that presented to the emergency department in Echuca as there was in Swan Hill. So in blue, you'll see Swan Hill, and in red, you'll see Echuca. And the following year, there was actually only one young person difference. And for us, that was a real surprise. It was a little bit spooky that we had the same numbers presenting at both hospitals, but it told us that the issue wasn't the quantity of young people, but the nature of their presentations. So what we actually found out, this slide, if you look third from the bottom, the row third from the bottom shows you what we identified the issue to be. And it wasn't so much the number of young people that presented to our emergency department, but the rate of multiple presentations for the same issues. So we had young people coming back to the emergency department time after time looking for mental health support rather than finding it in primary care settings. So what we did was set out to try and change this trend specifically. So you'll see in these two graphs, Swan Hill on the left and Echuca Regional Health on the right. you'll see that our wedge of multiple presentations in Swan Hill was greater, almost twice the percentage of Echuca, and we set out to do something about that. This is a slide where it has the number of young people at Swan Hill District Health in blue compared to the number of presentations of young people. And what we wanted to do was bring the green in this graph back to the blue, to try and see young people get help earlier and in the right context for them, instead of emergency departments in crisis. As well as the evidence that we tried to collect around our work with young people, we actually went to people. We went to young people themselves, we went to stakeholders who worked in the field, and we spoke to 106 different people from different levels of influence, from young people at the grassroots levels, their parents, up to CEOs of organisations, to find out how they saw the issues of youth mental health in our community. And this is what we found out predominantly. Most people felt like there was a lack of collaboration in strategic management. People said things like, it would be good to see more management that inspires the cultural change in the service system that needs to happen. People wanted someone to lead them out of it. People were saying, we need a clear picture of what we want to achieve. And one stakeholder said, there feels like there's no captain of the ship. Now, any who have an interest in youth mental health will know that our efforts need to be coordinated and they need to be organised and planned. And what young people and what their families and what the service sector wanted was someone to lead them out of that issue. There was a real desire for that. But people also recognised that there was no clear leadership also at the coalface. So people were saying things like, it's all about the organisation. It's not about the young people. It seems to be more to do with what the organisation's eligibility criteria might be, or we need to focus on the way that we work together as workers, people were saying. There's something that needs to shift about what we're doing. And someone said, I'm surprised at the number of services that would be involved with young people. And they went on to say that all these services could be involved, but never once sit in the same room with the young person or their family. And these were probably the glaring things that came out of it for us. So there were 8 or so recommendations, but the really important ones that I think produced the greatest piece of work was, first of all, to recommend that they establish an executive coalition from key agencies to develop a Swan Hill model for responding to young people with complex needs and also their families. So that lack of collaboration was never, or was something that people wanted to change most of all. So the organisations that were involved, they said, okay, our leaders commit to changing this issue. And it was amazing what they produced. The second recommendation was that the Murray Primary Health Network become the backbone support organisation for that work. So they extended the project that was happening at the time so that secretariat support could be provided to the leaders in the development of that local model that was going to suit Swan Hill. So we got together in October 2013 after the delivery of the report, and we got executive leaders from key organisations to come together to hear about what we found out, the sort of stuff that I've talked about earlier today. And they developed a terms of reference for that executive coalition. And in that executive coalition, there were a number of organisations that played a role. So the Swan Hill Rural City Council, the local district health service, so community health and hospital combined, the police, state-funded welfare organisations like Mallee Family Care, St Luke's Anglicare, Bendigo Health Psychiatric Services, so the tertiary mental health provider, the Department of Education and Early Childhood at the time, the Department of Health and Human Services, the local Aboriginal services provider, Mallee District Aboriginal Services, their Primary Care Partnership in Victoria, the Department of Justice as well, and the Murray PHN. And over the next 10 months, the CEOs and executive leaders of these organisations actually met once a month to develop a reform action plan that was going to produce better outcomes for young people. And it was the job of Murray PHN to support them in achieving that outcome. So it was at the end of that 10 months that they produced their reform action plan. So in September 2014, so it all began in December 2012. So this is almost 2 years later, the community was able to receive their reform action plan. And the executive leaders actually put together specific tasks that were strategies to address particular issues, and there were organisations who were given responsibility to carry out those tasks, and there was a time frame given. So it was planned. Did we know it was going to work? No, we didn't know it was going to work, but we tried something, we acted, and we worked together to try and achieve it. The Reform Action Plan had key objectives, but the number one thing, and I think this was a wonderful outcome of this Reform Action Plan, was that it was designed to improve the access of young people to coordinated care, particularly those with complex needs. So not just mental health issues, because people who are experiencing really complex life circumstances were often those that would develop mental health issues. So we don't need to provide support just to people with diagnoses, but we need to provide young people support that have an array of different needs. So we were going to develop a collaborative response, and we wanted to do that together. We wanted to promote the work that we were going to do to the community and actually provide an intervention not just for individuals but for a whole community, because there was a lot of fear and concern in our community that was focused on things that may not have been necessarily true. So it shifted the community to be more optimistic about our future and actually to take on a proactive role and actually seeing better outcomes for young people. So it was a wonderful time. And the CEOs of their organisations, the Executive Coalition, actually delegated to other members of their organisation to meet to develop what we called the Swan Hill Interagency Youth Service System Guidelines. So basically it was just something to put all in the one place. If you want to know how to work with young people who've got complex needs, then this is how you do it. It's a bit like a recipe. When I cook, I'm not very creative. I need to follow the recipe bit by bit by bit. And this was meant to be a recipe of that sort to help people to know how to work with young people with complex needs. So in the document, we had particular principles of care. So being focused on the young person, putting them at the centre of what your response is, a responsive and flexible service system. A couple of key ideas that you need to have if you're going to work with young people who might come with complex needs. Clear and consistent service provision. And then we talked about the characteristics that we wanted to embody, really our values as a service sector. And then we gave a bit by bit program logic for how to work with young people. How to do the plan, how to review the plan, how often to review the plan, how to put that into practice with families and young people. What are the issues around consent? So we talked about all of those issues to try and take away the barriers that were often things that families and young people came up against as barriers to service rather than as helpers to service, and they're meant to assist us. So we got together 100 people from the local service sector to train them in these guidelines. So the delegates of the Executive Coalition, they met for an extended period of time. I think it was 12 weeks on a weekly basis to develop those guidelines. And then we trained the whole community in those guidelines. So we had almost 100 people come to the town hall, and there was a lot of excitement because it felt like we were doing something significant to try and change our response to young people and their families. And we had a youth representative there on the day who was very inspiring for us. I can still feel just how much potency she had in her message, challenging us to work closer together for the needs of young people rather than being caught in our own practice, and it was really good. And for the first time ever, we actually saw a reduction in the number. So we were delivering that work in 2013. So you'll see in this slide that the following year, after we introduced this and after we trained people, we saw a reduction for the first time in 3 years in the number of young people that were presenting to the emergency department. So there's a number of assumptions that I'll communicate later on, but it was interesting that this work preceded a reduction in presentations for mental health disturbances at emergency department of our local hospital. You'll see in this one the breakdown of male and females that presented at Swan Hill District Health during that time. So from 2012, where we saw 84 presentations of young girls, down to 58 in 2015. And more specifically, that troublesome age group, well, not troublesome age group, how should I put it, that cohort of young people that were experiencing particular distress at the time when we first started the project, the 12 to 15-year-old females, from 36 presentations in 2012 down to 7 in 2015. And this one will show you that although we saw a reduction, there was still that third bottom row, which still focuses on the fact that we had people presenting multiple times. So there's a continuing challenge. It's not something that's fixed by any measure. Some people still return multiple times to the emergency department in crisis. But we saw from 45 presentations for suicide-specific diagnostic codes, we saw a reduction to 26. So in 2015. So we saw that decline in crisis. We saw that decline in suicidality in our community, which was something that was promising for us and encouraging for families. And here I've presented also the reduction in the presentation of Aboriginal and Torres Strait Islander young people at the emergency department as well. The presentations or the referrals to our psychiatric service provider in Swan Hill continued to remain about the same, and it was considerably less than Echuca. And some of the assumptions that we made after this was that the collaborative planning and the action that we put into place led to greater cohesion in services for young people, and a reduction in emergency department presentations for youth mental health issues. So we believe that our work together contributed to a more positive outlook and an intervention for the community that saw positive outcomes. We thought that the education that we carried out also led to a proactive approach to the improvement of youth mental health issues, and also that this collaborative work played a part in attracting Headspace to Swan Hill. We know that funding bodies are looking for communities that are showing cooperative effort before they become involved. So doing that work, demonstrating that you're able to work collectively for the outcomes of young people, will demonstrate your commitment and the commitment of your services to do it. And I think if you do that, you'll become attractive partners for funding bodies. So, I thought it might be good to talk about how this fits into the scope of primary health networks. So maybe you're in an area that doesn't have a Headspace. So what do? Well, your primary health network might be interested in finding out what Murray Primary Health Network achieved with this piece of work. So if you actually go to your web browser and you Google Swan Hill Youth Mental Health Project, you'll actually find on the web, it'll usually come up as the first option, a blog that outlines the piece of work that I've just described to you. So go on there, read the context, read the background of what was achieved, click on the links to download the report or the guidelines or the reform action plan to find out how we did it, what might be transferable for your community. We know the primary health networks, they've got plans for their primary care mental health care funding. So it's one of their priority areas that they've been given by the federal government. So how does this fit into what your primary health network might be trying to achieve in your area? I would recommend that you put it in that language and pose it to them in a way that you can achieve both your outcomes, improvement for young people and families in your community, but also help them meet their targets and their priority areas. Specifically in our region, you'll see highlighted here that primary health networks are really interested in the development of service integration activities to actually build the capacity of the sector and to improve outcomes. So if that's something that you want to achieve, then I would put it in that language. Put it in that language, conceptualize it that way, present your case to primary health networks. You'll remember from earlier in the presentation that it only costs really $75,000 a year for them to do that. It's not a huge investment, which could produce real lasting change for this service sector. So we were carrying out our work, and what we'd always been told was that Headspace was never going to be announced for Swan Hill. So we were trying to achieve what we could with what we had, rather than just waiting for the knight on a white horse. But the knight on the white horse somehow eventually came in October of 2014, and Swan Hill was announced in the Headspace Centres for round 7. And I can still remember the excitement that I felt when that was announced for our community. And we opened in February 2016. And yeah, it's been a wonderful journey of establishing that service. And Headspaces require the commitment of a number of different organisations to actually receive the funding. So there needs to be a consortium of agencies that are committed to the success of Headspace for it to even become viable. So the work that we did before meant that we had all these cooperative relationships. So when it was tendered for, the executive coalition got together and said, let's decide amongst ourselves who will be submitting the tender application for this. So there was no competition between our organisations because they've been cooperating for the last 2 years. So they appointed a particular person, a particular organisation that led that process. So there wasn't that competitiveness that sort of can often be the part of service development activities. Who wants to get the funding and who wants to be the lead? There was a more cooperative approach. And I think that's led to a culture within our organisation because of the ownership that's there, the commitment of different parties to each other. This is a picture of the team who are working hard up in Swan Hill to deliver supports. And they're doing a great job of helping to respond to needs early for young people in our community. We've got our service pathway in place. We've been able to integrate the clinical staging model from the very early stages into the way that we conceptualise mental health presentations of young people in our community. And this work has been really critical for us in having an evidence-based model that's delivering really positive outcomes for young people. So this work done by Shane Cross and the team up in Sydney has been really wonderful for us. And just recently, from concept, design, our new Headspace Centre recently was moved into in December of 2017. And we're very fortunate to have a brand new site that's designed just for young people. And yeah, we feel so lucky, oftentimes still pinching ourselves in thankfulness. But while that might be true for our community, we recognise that it won't be true for all communities, but a significant piece of work can be done to achieve. And we now, at Headspace Swan Hill, are actually putting into practice the guidelines that were developed then to encourage collaborative work so that young people don't miss out through organisations not being more organised and prepared. I won't speak more about the clinical staging model at this time, but I think it's critical. If you're thinking about doing work that's preventative and early intervention, then this model, I think, is essential for the way that you conceptualise that work and communicate amongst organisations. I'm sure there's lots of questions that you have, and I hope that they put my contact details with this so that you can approach us if you want to. But thanks very much for taking the time to listen, and I hope this is really useful for you.
Well, Ian, that was really insightful. Thank you for joining us again today. I guess just a couple of questions. So, when you were training the community back in 2013 on those guidelines, were there any significant challenges that you guys had to face in recruiting members of the community to come together in one place on a regular time to be trained on these guidelines?
So one of the good things that we experienced about doing this was the level of leadership that was provided. So we were very fortunate to have the leaders of their organisations who were then telling their staff that this is something that we really want to be a part of. So I think that was really helpful. Work needs to be grassroots, but it also needs to be led. It needs to have strong leadership. So we found that engaging leaders enabled us to engage the grassroots as well. So we found that really helpful.
Yep, and I guess what was the process that you had to go through in engaging those leaders?
Yeah, so the process was one of building trust with organisations, because traditionally there had been some conflict between particular organisations that were trying to achieve the same thing for young people, but there was a disagreement. So what had to be built up was trust and respect for organisations and an understanding of what the needs of each organisation were. So what I sought to do was actually to get to know these organisations, to go and meet with them, to talk about what we had done, and then to help them be successful in their engagement with our process. So executive leaders, they're time poor, so we actually need to help them to succeed in the room. So if I can spend 10 to 15 minutes with an executive leader to say, this is what's coming up in the agenda of sort of what's in the future for us, and this might be a way that is this a way that your organisation would be involved? And then they're sort of thinking about it before they even get to the meeting. So there's a lot of work. We would meet 2 hours every month, and some people gave up 4 hours of travel time because we live in a rural community to come and be there. You want to make the most of their time in the room. So do whatever it is you can to help them succeed in that environment. So I think that's a really important point.
Yeah, I agree. And I guess looking forward, what needs to be done now? I mean, like you said before, not each area has a headspace centre. So what do we have to do?
So we still need leaders, and I think there needs to be resource given to providing this effort to coordinate the support that's offered to young people and their families. Because what is often done, and it's not through anyone's fault, is that we become very active in doing what we do, and we're trying our very best to do the best for families and for young people, but we actually need to come together, because a team can provide far greater support than individuals. So if there can be leadership, these little seed-funded projects that might produce a collaborative response, and what is $250,000 or $250,000 over 3 years? Like it's such a small investment, but it could seed all of this wonderful coordinated work that could happen for young people.
I guess as a young person, one of the challenges that I feel that's common right now is lack of resources and services, perhaps. So, for example, long wait lists and being restricted to only having 10 sessions a year. Do you see a future where those challenges could be addressed, and how do you think we could do that?
We want to intervene not just with individuals but with communities. And we love the work that we get to do in educating our communities. Still, there's so many young people out there that don't actually access service because of the stigma associated with it. Acknowledging that you have an issue and the fact that they feel like they might be judged, and also they want to be independent too. You know, I want to get through this on my own. But if we deliver this support and education at a community level, our community, think of them like an individual. If they're stronger, if they've got the information that they need, and they've got an optimistic outlook, then you're actually going to have these communities that thrive, and hopefully at that level, we can see improvement too.
I think we'll just wrap it up there. Again, everyone, thank you so much for tuning in. Stay tuned for the next webinar coming up. And again, if you have any more questions, feel free to email us at training@orygen.org.au, and then we'll be able to get in touch with you in that way. All right, Ian, thank you very much.
No worries, Zoe. Thank you.
Thank you.